If labor seems to not be progressing simply because baby is not engaging, as birth doulas, birth partners, dads, we should consider where baby is at within the pelvis to support mom and help her flourish in her birth. If labor contractions seem to be very hard and strong and baby has been determined to be high within the pelvis at a -3, -2, -1 station, or if mom is experiencing hard back labor, especially in between contractions, simply because baby's head is angled at the tailbone rather than at the cervix, we should consider this that baby may not be engaged yet, or even baby's head may be grinding on the pelvic brim, making the uterine contractions harder and stronger, trying very hard to get baby inside the pelvis. Before any medical interventions are agreed upon, as doulas, we can give options to mom that can help labor progress. In our last video, we talked about when to use spinning babies during labor to make sure that the pelvic ligaments were balanced and even so that baby can be in a better birthing position, or even just to loosen up those ligaments. If labor just still seems to be stalled and baby is still high and not engaged in the pelvis, then we can consider 3 exercises that open the pelvic brim and open the pelvic inlet. These 3 exercises can be done with any type of birth: epidural birth, water birth, at home, or birth center, to get baby inside the pelvis. So number 1, the Flying Cowgirl. This is a great pelvic inlet opener to increase baby head engagement and is also epidural friendly and resting position friendly. To do this, have mother lay on her side with the peanut ball between the knees. The knees are far away from the abdomen and the back is arched and the pelvis is thrusted forward. Make sure mom's soles of her feet are stacked. Use this position for 3 to 6 contractions on one side and then repeat with the other. The second exercise is called the Water Walchers. You could have guessed this is perfect for a water birth. If mom is just not wanting to get out of the bath, it's totally fine because this one is a great option. So in the hands and knees position, the top of the pelvis can be opened by angling the femurs far from the belly, bending the knees and tucking in the pelvis or arching the back so that the feet are actually out of the water. This creates the space at the top of the pelvis to help baby's head engage. Doulas, birth partners, dads, you can hold mom's feet to help stabilize her and support her in a contraction. And mom can easily come out of this position in between contractions and move back into this position during a contraction. This position should be held through 3 continuous contractions. Lastly, the abdominal lift and tuck. This is a great one to help baby's chin flex and slip off of the pelvic brim into the pelvis, and is a great and easy one for dad and mom to do together. So what you want to do is have mom engage her TVA muscles, bringing her belly in towards her spine about 2 inches. Then have dad stand behind and interlace his fingers around the lower abdomen. And before a contraction begins, lift the belly up gently as mom relaxes and leans on dad's chest, bending the knees slightly and swaying to comfort. When the contraction ends, make sure that mom leans forward and dad lowers the belly gently. Repeat the abdominal lift and tuck through 10 contractions in a row. After these exercises, baby should quickly move past the pelvic brim and engage into the mid-pelvis, where you can work on more productive movements to further progress mom's labor. Well, that's all I have for you in this video. Thanks for watching and see you in the next one.